I was pretty young when my dad made me a deal. I had to learn how the game worked if I wanted to keep playing. When I look at technology today, what I see is the best in all of us coming together to accomplish the impossible. For me, computer science was the obvious choice in college. Then it was medical school, and then business school. I have always worked in the intersection of technology and healthcare. Robotics and joint replacement made sense to me from the very first time I used it in 2013. What appeals to me is that we can plan surgery on a 3D model, refine the plan using dynamic data during the procedure, make precise cuts with the help of a robotic arm, and accurately place implants in the ideal position. It's personalized, precision medicine in orthopedics. I think it would have seemed impossible even to the pioneering surgeons performing early joint replacements. If you're interested in learning more, we'd be happy to see you in clinic and go over the best treatment options for you.